In the last video, I introduced a foundational idea. The body is intelligent and it's constantly adapting to the conditions it lives within. And if that's true, a very important question follows. How do we see those adaptations and how do we know what the body has been adapting to? Because if adaptation is happening beneath the surface, it leaves evidence, it leaves clues, clues in energy, in digestion, in sleep, in mood, in hormones, and in blood chemistry. And that's what I've spent 20 years learning to read. And today I want to introduce what has become one of the foundational doctrines of this work. The pattern is the diagnosis. It's not the symptom, not the label, it's not the disease name, it's the pattern. Because patterns show up long before diagnoses. And if we can learn to see them, we can often change the trajectory before disease takes hold. Modern medicine has accomplished extraordinary things. A car accident, heart attack, a life-threatening infection, emergency surgery, you better believe there's nowhere else I would want to be. Modern medicine was built for acute problems and it solves them brilliantly. The challenge is that most suffering today comes from a different category entirely. Chronic disease, chronic fatigue, weight gain, insulin resistance, autoimmunity, hormonal changes, depression, cognitive decline. These don't arrive overnight. They develop slowly, often over years, sometimes even decades. Long before a diagnosis appears, the body begins sending signals. Energy changes, sleep changes, digestion changes, mood changes, blood chemistry begins to shift. Patterns emerge, but because we're looking for disease, we miss the dysfunction. Because we're waiting for a diagnosis, we overlook the early warning signs. And this is where many people get lost, not because their body failed them, but because their body was adapting long before anyone was paying attention. In conventional medicine, we wait for the house to catch on fire. In systems medicine, we train to pay attention to the smoke. When I started practice, I thought like most clinicians. This symptom meant this problem, this diagnosis meant this protocol. But after enough years and enough patients, something shifted. I started seeing the same symptoms traveling together. The woman with fatigue almost always had digestive issues. The person with blood sugar problems almost always had sleep problems. The person with autoimmune disease often had gut issues. And the person with hormonal imbalances almost always had stress chemistry issues. The symptoms weren't random, they were organized. Different people, different ages, different diagnoses, same patterns. So the problem with the diagnosis is that a diagnosis is often just a name. It's a label for a condition that's become recognizable enough to receive one. It tells us what something is called, but it rarely tells us why or how it developed. By the time someone is diagnosed with insulin resistance, Hashimoto's, depression, or autoimmunity, the body has often been adapting for years. The diagnosis is simply the point at which the pattern becomes obvious enough to name. Think of it this way. A woman can spend 15 years moving towards diabetes before it appears. A person can spend a decade moving towards Hashimoto's before antibodies become elevated. Someone can spend decades moving towards cardiovascular disease before experiencing an event. The diagnosis is the final chapter. The pattern, however, is the story that came long before it. One of the most common things I hear from new patients is this. My doctor told me everything looks normal, but yet they don't feel normal. They explain that they feel anxious, they feel tired, they've been gaining weight, sleep isn't consistent, and something feels off. But the blood work says everything is in range. Why? Because laboratory ranges were designed to identify disease, not optimal physiology. Systems medicine asks a different question, not is disease present, but rather is adaptation already occurring? When we review blood chemistry through a functional lens, we use narrower ranges. We call them functional ranges that reveal early shifts before pathology develops. This is the difference between disease detection and what we call pattern recognition. Blood chemistry is one of the most powerful tools that we have in healthcare, not because it diagnoses everything, but because it gives us a common language. Symptoms are subjective, but blood chemistry is objective. History provides the context, and together they tell us a story. This is where I want to introduce to you the famous five. After 20 years in practice, I found that most chronic health complaints organize around five reoccurring physiological patterns: blood sugar dysregulation, stress chemistry and nervous system dysregulation, gut and immune dysfunction, inflammation and inflammatory overload, and then hormonal adaptive reserve decline. Every person is unique, but these patterns appear with remarkable consistency across different symptoms, different ages, and different diagnoses. I want us to look at three of them. First, blood sugar dysregulation. When most people hear blood sugar, they think diabetes. I think energy, I think fuel regulation, and I think communication. Blood sugar is one of the body's primary signaling systems, and when it becomes unstable, the consequence ripples everywhere. Cravings, brain fog, fatigue after meals, afternoon crashes, difficulty losing weight, difficulty sleeping through the night. The blood work often reveals early clues: the fasting glucose, A1C, the insulin, triglycerides, and even uric acid shifts out of the lab range long before it's flagged on the report and then long before diabetes develops. And here's what makes this pattern so consequential. Blood sugar doesn't just stay in its own lane. It influences our hormones, our immune response, our nervous system, our microbiome, and that influences our sleep, our mood, our energy, and just the feeling of feeling well. What begins as a fuel regulation issue quickly becomes a systems issue. The second pattern is nervous system dysregulation and what we call stress chemistry. If there's one pattern I see most consistently, especially in women, it's this one. Most people think stress is emotional, but stress is actually biological. Stress chemistry influences nearly every major system in the body: blood sugar, sleep, hormones, digestion, immune function, brain health and cognition, and certainly our ability to recover. This is the woman who has spent years carrying enormous responsibility: her career, her family, her children, her parents, her relationships, and her own internal expectations. The body adapts beautifully until eventually the cost of that adaptation becomes visible. She's wired, she's tired, she's waking up in the middle of the night, she's gaining weight despite possibly doing everything right. This isn't weakness, this is not lack of willpower, this is physiology. It's that the body's been adapting for a very long time. The third pattern I want to share is gut and immune dysregulation. The gut is far more than just digestion. It's actually an immune organ. It's a neurological organ. It's a hormonal organ, and it's a metabolic organ. When gut function changes, the effects can appear almost everywhere: food sensitivities, bloating, autoimmunity, skin issues, joint pain, brain fog, fatigue. The symptoms may look unrelated, but the pattern is often remarkably coherent. Everything talks to everything. Blood sugar talks to hormones, hormones talk to the nervous system talks to the digestion, digestion talks to immune function talks to inflammation, and inflammation talks to everything. This is where systems medicine diverges from the conventional model. Specialists divide the body. Systems medicine reconnects it. And when we reconnect it, something remarkable happens. The women with anxiety, Hashimoto's, bowel issues, weight gain, insomnia, and brain fog no longer looks like six unrelated problems. She begins to look like one coherent pattern. The body has been telling the same story through multiple channels, and our job is to understand how to listen to the symptoms and trace them back to the pattern. This is why I begin every patient relationship with a comprehensive case review: symptoms, history, and blood chemistry, including lifestyle patterns. Each piece tells a different part of the story, but together they tell us the whole story. That's where pattern recognition begins. And once we identify the pattern, we can stop guessing. We can begin working with the body's intelligence. We can address the root causes, and we can restore the resilience and the body's ability to adapt. Video one established that the body has been adapting, and video two showed us how to recognize the pattern. Now a new question emerges. How do we start and where do we begin? After 20 years of practice, I discovered something that changed everything. The right intervention at the wrong time often fails, but the right intervention in the right sequence often changes everything. And that brings us to the third doctrine of systems that heal. The sequence is the method, and I'll see you in the next video.